name's Steve Fairman and I am proud to be Managing Director of NHS Improving Quality, which is the national body charged with supporting organisations to improve the way that they care for patients, to really improve patient outcomes, quality and safety in the NHS. I'm wanting to communicate really with chief executives and boards of organisations. I want a leader-to-leader conversation because I think that's important. It's not always seen as the most important thing in organisations. Sometimes the operational requirements of running to keep up can be overwhelming for chief executives, and I want to ask them to pause and have a conversation with me. The Quality Service Improvement and Redesign programme is really a collection of tools which are evidence-based. They've been used for some time by improving quality in the NHS, and what we want to do is we've now redesigned it as a train-the-trainer programme, and so we're saying to organisations, you can now come forward, put some of your people on this programme and actually build within your organisation the capability to self-improve and really build a continuous improvement culture within your organisation, which is so important for patient care. I think the most important things are actually they will be able to improve the patient experience. So they will improve the patient experience, they will improve the outcomes that the patients get. Most importantly, they will be able to reduce waiting times, which is, I know a lot of organisational leaders feel under a lot of pressure about waiting times. So they will be able to do these things. And it's a whole package. So it really includes a range of things which will bring real positive benefits for patients. What I want chief executives to do is to really commit to this programme, and by committing, what I mean is creating the space to allow it to happen. Provider organisations are very pressured, and I understand that everybody's very busy, but actually chief executives need to be able to take a step back and create some space to allow some people to come onto this programme and really create, when they come back, a bit of space for them to start rolling that programme out through their organisation to really build those internal capabilities to make patient care better. And actually, over time, it will massively improve value for money in their organisation as well, because actually they're not going out to consultants all the time to come in to help them. They are creating that capacity and capability internally. The board need to really support the chief executive. So the board, I'm sure, are already well aware of all the operational pressures their organisations are under. They can go down and visit the A&E department, they can go and visit outpatients and see the pressure that the organisation's under. And they need to support the chief executive in creating this space and really moving around the organisation and valuing the improvement work that people are doing on the ground, because it's very important that people see that what they are doing is being valued by the leaders of the organisation, and that is the board. I know that it works because a few years ago now I went on as a member of an SHA board, I went on a programme called the Academy for Large Scale Change, which was developed by the Institute for Innovation and Improvement in the NHS, and that was really about getting teams, leadership teams together to understand the approaches that we could take to really make large-scale change happen across an area. And we were given tools and techniques, and we worked together on our own problems as a team, using those tools and techniques, and it works. And that's exactly what this Quality Service Improvement and Redesign programme is doing, but at a slightly different scale inside an individual organisation. I think what we would see is not just changes in individual organisations. If lots of organisations took this on board, I think we would get a change in expectations, not just of patients as they go into an organisation, but actually of the public in general, of the healthcare that they can expect. We look around the world and we can see that places like in Seattle, they've got the Virginia Mason Health Centre, or in Salford in our own country, where organisations have really taken it on board to skill up their own staff with improvement capability, which gives a continuous culture of improvement, and that is really having an impact on the way that patients who visit that organisation, the expectations that they have, but also on the expectations of the local public too. I want them to commit, to say, yes, I want patients in this organisation to get the very best care. I want to skill up my staff to create a constantly improving culture which will really impact on the safety and quality of services available inside this organisation. I want to make sure that they really understand that actually the information they're getting at the board is information which is helpful to them to improve services and not just about pressure points in the operational running of the organisation. I want them to understand that actually they need to create that culture because it's what patients deserve.